At SA Ambulance Service, we receive almost 700 000 calls daily. Thankfully, they're not all urgent or life-threatening cases, and that's one of the reasons why we've made an important change. To improve our service for non-urgent patients, we have introduced a new service called Clinical Telephone Assessment, delivered by a team of experienced paramedics.
Hello, I'm Angelique and I've been a paramedic with SA Ambulance Service for near on 14 years now. I'm really excited to be a part of the new team, working together with my colleagues to provide a different sort of service but an essential one for our patients. Clinical telephone assessment for us means that we can ask some questions that are really going to delve into the patient's problem, and it's going to give us a guide to the best options for that patient in terms of their healthcare.
Here's how clinical telephone assessment works. Firstly, for 000 calls that are urgent, there is no change, and they will continue to receive an emergency response. But in cases that are not urgent, the caller may be transferred to a paramedic telehealth clinician who can work through their symptoms over the phone. This is a detailed clinical assessment that asks the same questions that a paramedic would use in a face-to-face assessment. But because it's done over the phone, the clinical assessment can happen sooner than if the patient waited for an ambulance. The paramedic telehealth clinician will then work with the patient to identify the most appropriate care for their circumstances. This may still mean an ambulance and hospital emergency. In fact, for some patients, this clinical assessment will see an ambulance dispatched sooner if it reveals the patient's condition is more serious than first indicated. However, other care options now include treatment at a priority care centre, home-based care from one of our extended care paramedics, or a referral to the patient's GP or a locum doctor service. And less serious cases may only need reassurance and advice on self-care. And importantly, these changes will leave more ambulances and paramedics available for the most urgent cases. Remember, just call 000 as you always have.
SA Ambulance Service, we're right here for you.